This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Good evening, everyone. Sounds like we're the final ones here. I am Chris Meadows. I'm one of the faculty here at Providence St. Luke's, located in Spokane, Washington. I have the pleasure to introduce a few of our residents that are here with us tonight, as well as a future resident, and they're going to present to you a PowerPoint presentation that they've done an excellent job putting together. So I'll start quickly by introducing Tyler Bates. He's on here, and he is a future resident that will be joining us next year. So he will be a PGY2 in our program next year. And then in addition to that, we have Trevor Mordhorst as well as Kate Whiteneck. They are both PGY2s here with us. And as mentioned, they're going to share with you in just a brief moment. And I'm hopeful that our program director, Dr. Ross Bogie, is on. I don't know if he was able to join with us to say a few things. Dr. Bogie, are you with us? Maybe not quite yet. Hopefully he could join with us here shortly. But I'll start by just introducing briefly. As mentioned, we are in Spokane, Washington, and we are a relatively new program. We have 2 classes with us. So as mentioned, a couple PGY2s here tonight, and then we have a PGY3 class. So not quite a full cohort, but will be in the next year. We take 6 residents per year. Let me just turn it over to Trevor and Kate, who will share their screen for a presentation, and I will be in the background answering questions. So hopefully, if you have anything, I'll do my best to answer those. All right, Trevor and Kate, you guys take it away.
Hi, everyone. I'm Trevor.
And I'm Kate.
And we will share this presentation. Let me see here.
I think you need to spell.
Sorry, bear with us as we get this figured out real quick.
Oh, yeah, just click the thing. Sorry, we're not great at zooming or.
Okay.
Can you see our screen?
Yep. You just wanted to throw it in presentation mode.
Sure.
There we go.
Perfect.
All right. So like Dr. Meadows said, we're out at Providence St. Luke's here in Spokane, Washington. Here's a beautiful picture of Spokane, and we'll tell you a little bit more. So today we're going to go through a little bit about St. Luke's as a hospital and rehabilitation facility, talk about kind of our patients, program details, and tell you a little bit more about Spokane. So St. Luke's Rehabilitation Center is a standalone rehabilitation center, but it's associated with the Providence network. It's the largest rehabilitation hospital in the inland Northwest. Opened in 1994. It has 102 beds. We're kind of operating at a little less than that right now due to staffing and all of the things associated with COVID. It's a level 1 rehabilitation hospital, accredited for adult and pediatrics and brain injury, spinal cord injury, and stroke. We see quite a bit more than that. Has a good reputation within the community and is fairly well known within Spokane and the surrounding area. And like Dr. Meadows said, there are 6 residents per class. We're the PGY2 class, and then there's the 6 in the PGY3. So we have a quite large encashment area, and you frequently see patients not just from the Spokane area, but a much broader area from Oregon, Washington, all over the state of Washington, Idaho, Montana, and even from Canada. But I would say for the most part, we see patients from these 4 states. Here's a little bit more about our facility. There are multiple rehabilitation gyms. I think this is the main one, but 3 or 4 total. We also have a wonderful pool here that's kept at body temperature. So there are multiple therapy sessions and therapy within the pool. There's also community simulation areas. We have a plane back there. There are multiple cars. There's a restaurant, a bank, a little grocery store. So all of these things that help patients feel more comfortable before they get sent out into the real world and kind of practice skills like boarding an airline. We just recently used this last week for a patient that we were sending back home to Colorado. There's also independent living apartment with occupational therapy to kind of cook and do ADLs in an observed environment. There's assistive technology lab and adaptive sports within the area, primarily basketball, but also some water sports like skiing. There's an outdoor community park therapy area with multiple different terrains to practice simulating what life will be like after St. Luke's, such as multiple different stair widths and ramp types. You can kind of see in the back that there's a playground area for our pediatric patients to kind of practice getting back on the playground and back to doing the things that they enjoy. A little bit more about the program. So PGY 2-year is all inpatient. There are 2-month-long blocks in spinal cord injury, brain injury, MSK, neurorehabilitation, amputee, and general rehab. In practice, they're a little bit mixed, but we primarily see patients from those specialties when we're on those rotations. PGY 3 is primarily all outpatient. And we have a pediatric rehabilitation at Shriners here in Spokane, not too far from where we're at St. Luke's. There's a pain management elective over at Swedish in Seattle. And so we'll go over to Seattle for 2 months. We get that done earlier in our 3rd year if you're interested in pain fellowship. There's neuromuscular disease, stroke, and EMG. And really, there's quite a bit of EMG throughout your 3rd year on even other rotations. As we mentioned, spinal cord injury, amputee, MSK, kind of your standard PGY 3-year. And then PGY 4 does more EMG, some tone management, research, electives. And there's this tentative inpatient rehab role where you take the role of a sole provider at a rehabilitation facility. This is getting arranged, but it'll likely be in Montana, just with attending support by phone to kind of simulate us being in the real world after a residency. The call schedule, we have 24-hour calls. It ends up being about every, say, 8, 9, 10 days, something like that. It is variable. It's shared among all of the PGY 2s and 3s. However, most of it is taken by PGY 2s. There's on-call attendings available that we can call at any time if you need support. And Sacred Heart is the associated Providence hospital, and it's quite easy to send patients out if they need a higher level of care. And PGY 2s cover holiday call, and so it's spread between 6 residents. Call is not too bad because we're a rehabilitation facility, and so the acuity of calls are on par with most rehabilitation facilities. It's much more pain management bowel care and things like that. We have a wonderful call room with private bathroom, shower, fridge, nice bed there, TV, kind of all of the amenities. And then there are beautiful areas to sit outside and enjoy your lunch and enjoy breaks or time off. This is just right outside the cafeteria, and the area is quite magnificent in Spokane fashion with the mountains and pines. The benefits are on par with most other programs. Here, I'm not going to read all of this, but I'll just kind of highlight it. We do get 20 days of vacation, and so 3 of those are blocked typically to allow the 5 work days and the weekend before and the weekend after. And if you don't end up getting that, then you can always trade your call days, and that would be the reason why you don't get that full block of time. 3 groupings of 5 days are scheduled each year, and then you have 5 days that you can use individually and place them however you want throughout the year. We also have 3 half days per year for personal wellness days. You can use those at any time. And those are independent from a dentist appointment or a doctor's appointment. We can always get time off for those and not have to use our wellness days. You have essentially unlimited food at the cafeteria here. There's $3,000 per year stipend. The parking is nice and easy, free, and easy to find a spot. We use Epic for our EMR. There's Dragon, standing desks, and multiple very nice work areas with dual screens.
And plenty of them.
Yeah.
You can always find a computer.
For the most part, we work one-on-one with attendings, which is very nice. It helps to kind of expedite your day and do some learning with these wonderful attendings we have here. There's an educational stipend of $150, and then your insurance and investment opportunities that are similar to all the other programs. Didactics are every Friday. This is protected time. It's your full morning. Usually we're done at 12 or 1. Faculty-driven lectures. There are skill sessions in EMG and ultrasound. Independent from Friday didactics, we do a journal club and medical case review. And then everybody has to do a scholarly activity. The didactics are 18-month rotating schedules with a unique kind of starting set of lectures for PGY2s, where you kind of go into like spinal cord emergencies and all of the things that you really need to know right off the bat. And then you meet back up with the PGY3s to do all of the other didactic sessions. This is our wonderful staff, or I'll let Kate take over from here. Sorry.
Yeah, so we have great staff here. I feel very supported as a resident. I find they're very, very easy to work with. They're very supportive. I'd read you all their names, but I don't know. I hated when people would do that during our PM&R Scholars, because like you don't know who they are, but you should, because they're all wonderful people. Here we have Dr. Bogie, he's our program director, and Dr. Carter, the chief medical officer. We see them like daily almost. They're around, so it's nice to have them at arm's reach. And this is our PGY2 and PGY3 group. I'd say we have a really great group. Everyone's really fun to work with. And this is us kind of in the back over in the same area as that little waterfall outside. So there's plenty of greenery that you can easily get to outside the hospital if you need to. Wellness, I feel like we have all the same like bread and butter wellness stuff that all the programs do, but I think our program is really great at actually giving you wellness. We have such a good work-life balance here that, you know, there are all these other wellness offerings, but I feel like the program offers wellness just in the way that it's set up. Location-wise, so Spokane is in Washington. We're on the east side, a very short drive to Coeur d'Alene, a beautiful spot in Idaho.
And it's about a 4-hour drive to Seattle, and a quick flight with our airport. It takes like 45 minutes to fly to Seattle.
Yeah. So Spokane itself is kind of, it's on its own out there. There's about 230,000 people. There's a few smaller surrounding cities, but we're pretty much the biggest in the immediate area. We have all 4 seasons, which is great. You get to enjoy fall and spring, and you get some snows. There's a lot of fun things going on in the town. There's, no lack of things to do throughout the year. The thing in the top left is from like an old fair, and
Yeah,
I don't know what
it's
from.
Waterfront Park, and so they have very big name concerts there. It's a new facility that they renovated, and so there are concerts there all summer long.
Yeah, it's cool. It's like outside, and it's kind of like a tent thing, but there's lights on it. It's open air. It's great. And then off to the right is the waterfront park. You can see the fixture there in the top left. And then on the bottom right is Manitou Park, this absolutely gorgeous park, kind of south of the hospital. It's just this giant free park. There's like a Japanese garden there. There's a rose hill. There's absolutely everything you can hope for. And these are all flowers on the bottom. It's gorgeous. Highly recommend. And then thirsty, hungry, whatever you want, you can find it around here. There's lots of great coffee. You can find any kind of food you want. There's a ton of breweries if that's your thing. Yeah.
Yeah, Spokane has a wonderful selection of food and barbecue. There's a lot of barbecue in the area. Great place for food and drink.
And then if you want to get outside, you can definitely find that too. Like I said, work-life balance. So there are a ton of walking, hiking, biking trails very close to town. Like I've lived in Boulder and Portland, but this is the closest, like in city, the closest to an outdoor area that I've ever lived around. And there's ski resorts everywhere. I think the closest one is maybe an hour.
Yeah, and like 10 minutes from where I live, you can get up hiking in the mountains and get pretty rugged pretty fast. So yeah. It's a wonderful area for outdoors.
Yeah, it's beautiful. So, whatever you want to do, we basically have it here. So we'd love it if you would come join us.
Yeah, thank you for watching our presentation, and we'd love to talk with all of you and have you here.
Yeah, any questions?
So to speak about the benefits of training at a standalone rehabilitation facility, I think you're going to have a lot similar experience to what you would have in a hospital with types of patients, maybe a little bit less sick because you don't have quite the access to the hospital as you would if you were attached. I think some things like labs can take a little while to come back and things like that. So you don't have quite as sick of patients because we just can't manage them. And so benefits as a resident is there are less emergencies and things that you have to respond to. Patients are quite a bit more stable here. I think I can't really think of.
I'll add to the fact that from a training standpoint, we can focus on PM&R training and focus on the residents that we have. So despite the Providence program within this Spokane Northwest region, we do have internal medicine, family medicine, psychology. They are not, underneath our house here. So we can, from an attending or from faculty standpoint, we can really focus on the PM&R training of the residents ourselves. So there is some kind of benefits to being within a hospital and acute care setting because you have access to more resources. But with every patient that's here is a rehabilitation patient, so we can focus on the rehab needs. Of course, every freestanding rehabilitation hospital has its ups and downs, but it's definitely a good opportunity to really focus on rehab, in addition to the fact that our clinic is attached to our acute rehab facility. So our clinic is directly connected. So you get basically all of your training within house. As mentioned, we do have to outsource a little bit for some pain, where we go to Swedish, and there's just a more advanced and more rigorous curriculum out there that we can offer for our residents. But for the most part, all of your clinic and all of your inpatient exposure is going to be here. As mentioned, we do have our sister hospital, which is Sacred Heart, which is less than a half a mile up the hill, where we will do our consults. And that's a level 1, might be a level 2, but level 1 or level 2 trauma hospital. So with regard to, just looking at some of your other questions here quickly, with regard to residents from anywhere else, they come from all over. It was a question earlier about whether we have PGY1 or categorical. We are not technically categorical, but we do have 2 official spots reserved for our PM&R program. So 2 residents will come directly from there. We are hoping to expand that as that program is expanding. We're hoping to make it all 6. Unique patient population assessed pathologies. Actually, Sacred Heart, our sister hospital, is the largest hospital in the Northwest region, from us to, I think, Rochester to the Mississippi. So we get a huge catch of patients of all types of pathologies. People asked about cancer rehabilitation in the previous presentation. We get a ton of cancer. So that's not a formal rotation, but you get it throughout our brain injury and stroke populations. Please, yes, email us with any questions that you may have. What resident qualities does your program most value? Probably teamwork and being, excited to learn. There's some independent learning. I think with any residency training program, you want to be good at your independent learning skills. So we do expect that you're going to come in excited to learn and do some independent reading. Of course, each rotation will have a curriculum for you to go into and take some reading home, reading papers regularly, of course, coming to didactics expected. There was a mention about families. We do have a number of residents that are married, also that have kids. So we actually have a wide group of kind of different various backgrounds from our resident standpoint. But it's a very family-friendly program, as well as a family-friendly neighborhood. I have 3 children of my own from the ages of 8 to 3, and they're very involved in their schools and in the community. And as was already alluded to, there's plenty of outdoor exposures, from sports to entertainment. One thing that wasn't mentioned was Hoop Fest, which is a huge 3-on-3 basketball tournament that happens annually. And that gets over thousands of people. It's a full weekend in which our sports medicine department is involved in. One thing that was also not mentioned was the Bloomsday. So that's an annual marathon that's done, and it's huge. It just attracts people from all over, not just the Northwest, but all over the country. So there's plenty to do. Winter sports, skiing. Our sports medicine program does some of the first aid with regard to our mountains, or our ski training. Of course, that continues into the summer, where there's hiking. We are surrounded by lakes, so there's no shortage of bodies of water. So you can get some outdoor water activities as well. So very family-friendly neighborhood. So if you have kids, they're more than welcome. Please email us. Looks like Kate and Trevor both left their email. We'll also put the contact information for our program into our PowerPoint when we send it over to PM&R Scholars. Thank you all. I really appreciate you guys' time and questions. Thank you to PM&R Scholars for putting this on, and we'll hope to hear from some of you in the near future.
Thank you all.
Awesome. Thank you so much, St. Luke's. Appreciate the great presentation. And thank you everybody for being here. Again, those on the East Coast staying up late, and those on the West Coast joining us right around wintertime. We really appreciate your time. Keep an eye on your email inboxes for the next session. We'll keep on rolling. I think we got about 4 or 5 more nights of programs coming on, and then we definitely will be keeping on posting the recordings to our YouTube and podcast pages. So keep an eye out for that. Have a great night, everybody.